The female reproductive system is an amazing part of the body, essential for both reproduction and overall health. Today, we'll break down the key organs and explain how everything works together. First, we have the ovaries, two small oval-shaped organs. They're responsible for producing eggs and hormones like estrogen and progesterone, which keep the menstrual cycle on track and help with pregnancy. Next are the fallopian tubes. These thin tubes connect the ovaries to the uterus. When an egg is released, it travels through the tube, and this is where fertilization usually happens if sperm meets the egg. Now, let's focus on the uterus, or the womb. This is where a baby develops during pregnancy. Each month, the lining of the uterus thickens to prepare for a fertilized egg. If pregnancy doesn't happen, the lining sheds, which is what we know as a period. The cervix is the gateway between the uterus and the vagina. It controls the flow of fluids, like mucus, that can either block or help sperm during different stages of the cycle. When it's time to give birth, the cervix opens up so the baby can pass through. The vagina, sometimes called the birth canal, has several roles. It's where menstrual blood leaves the body, it's part of sexual intercourse, and it also expands during childbirth. On the outside, we have the external genitalia, including the labia and clitoris. The labia protect the internal organs, while the clitoris, with its many nerve endings, is highly sensitive and plays a role in sexual pleasure. Lastly, there's the pelvic floor, a group of muscles that supports the organs and helps with things like childbirth and bladder control. Strengthening these muscles is super important for pelvic health. Let's take a quick look at the menstrual cycle. It starts with the menstrual phase, when the uterus sheds its lining. Then, during the follicular phase, the ovaries prepare to release an egg. Ovulation is when the egg is released, and in the final stage, called the luteal phase, the uterus gets ready for pregnancy. If no fertilized egg attaches, the cycle begins again. Understanding the female reproductive system is key to keeping track of your health. From the ovaries to the pelvic floor, every part works together to support life, balance hormones, and ensure well-being. Knowledge is power. Regular checkups and staying informed can help you make better health decisions.
Subscribe at Daily Reproductive Health today and get personalized updates at dailysexcare.com.